Good day, and welcome to Your Health Matters. I'm Lisa Brown. Between 5 to 25% of children and teenagers in the United States are obese. As with adults, the prevalence of obesity in the young varies by ethnic group. It's estimated that 5 to 7% of white and black children are obese, while 12% of Hispanic boys and 19% of Hispanic girls are obese. Some studies indicate that obesity among children is on the increase. According to the Centers for Disease Control and Prevention, 16% of children, 9 million children between the ages of 6 and 19 years old, are overweight. Childhood obesity is a growing concern among healthcare providers and agencies who concern themselves with the well-being of children. My guests today are from the Council for Child and Adolescents with Chronic Health Conditions. It's a nonprofit organization. I'd like to welcome Denise Brewitt, Executive Director of the Council, and Sue Avard. She is a member of the Council and also a registered nurse. And welcome, ladies, to the show.
Thank you.
Glad to have you. For people that don't know about what the Council is all about, in a 30-second soundbite, maybe you can tell me what your organization represents.
Sure, I'd be happy to. The Council is an advocacy organization. It's a statewide organization here in New Hampshire that advocates for families and for children who contend with chronic health conditions. We work with Health and Human Services, the Department of Education, the Insurance Department, as well as our New Hampshire legislators to advocate for those families, be it in a school situation, community-based, insurance-wise, or if there needs to be some type of legislative change so that these families are supported.
So how do we get childhood obesity onto the radar screen for this organization?
Well, unfortunately, childhood obesity is on the rise here in New Hampshire as well as across the nation. And in fact, it is now considered a chronic health condition for children and for adults. But also, obesity leads to developing other chronic health conditions, diabetes, heart disease. So it's definitely something that as New Hampshire citizens, we really need to focus on because our children are becoming unhealthy right in front of us, and we're setting them up for, disaster, basically.
Well, as a nurse, Sue, what do you see as you're out there working with young people?
It seems that I think, what is going on? What is the epidemic? Is it that our children are not as active as we were when we were children? I mean, when I was growing up, you got up in the morning, you were outside playing all day. You were not sitting in the house. Is it the TV, the video games? Are parents working longer hours and the kids are left home alone so that they're left home, but they're not allowed to go outside and play, so they're not having that constant activity that they used to have. The rate of the obesity in children is very high, which is now, young children now with diabetes and being treated for these chronic health conditions is just increasing everywhere.
And when we say diabetes, you're on the front line. You're the one that's sitting there going, okay, this kid has to have an injection today because they have diabetes.
They need to check their blood sugar. They need to watch what they eat. They need to be aware.
And what kind of lifestyle is that for a young kid?
It's very difficult. There are children that, unfortunately, they didn't choose it. They were born with having difficulty with their blood sugar levels and needing the health care. And other kids, it's just with poor diet, no exercise, increased weight. You put on 10, 15 pounds, your chances of diabetes increase.
Does it increase at a certain age? Or is there a certain... when we have children, they're cute and cuddly, and they have those thick little thighs, and we just think they're the little running backs. And then everybody says, well, don't worry, they're going to just shoot up pretty soon. When is that? When do you start saying, okay, wait a minute, this kid is not filling out the way we thought he or she was going to do? And when do you start saying, okay, we need to do something?
Well, that's really developing that communication with your pediatrician. When your child goes for those well checkups, they have their where they fall on the growth chart as well as the weight chart. So they measure your height and your weight and where you fall on that line. And if we have children who, it's one thing if you're at the 75th percentile for your height and for that you're consistent, but it's different if you're a small child and you're very overweight. I mean, so doctors are following that. It's opening those lines of communication with with your physicians to have them open up that dialogue. So but I definitely think that you can see where they start to fall off that chart, and most pediatricians are pretty good with letting you know.
What are some of the statistics that you have? I don't know if you have national statistics or New Hampshire statistics about childhood obesity. I mean, when I introduced you both, I'm saying it looks like we have perhaps as many as 9 million children between the ages of 6 and 19 who are considered overweight.
Right. Well, the Foundation for Healthy Communities invited New Hampshire primary care practices to participate in a voluntary statewide medical chart review to project and document childhood obesity here in New Hampshire. So that would be using those pediatricians' charts that I was just discussing. And the data was taken from a sample of 25 primary care practices from 17 different New Hampshire communities. And taking statistics from roughly 1,500 children randomly identified from those visits in 2005 found that 32.8% of the children from ages 6 to 12 were overweight or obese.
When they're saying overweight or obese, what is considered overweight? What's considered obese? Is it, you as a nurse might know the difference between what is it, body mass versus?
It is. It's a certain percentage of weight over what their normal actual weight should be for their size. I want to say 20%. I'm not really 100% sure on the statistics.
The documentation that they were using for a child is overweight or obese is according to their BMI, and it's
Body mass index. Right.
Correct. And the documentation in the medical chart is the key step to addressing the individual, assessment of that child. So in this study, it found that the medical charts of most children who are overweight or obese did not have documentation about weight in the problem list. So that was interesting that,
In the problem list.
Right, exactly. It wasn't until and that's what I mean by starting that dialogue with, as a parent, if you're concerned about it, to start opening up that dialogue with those pediatricians.
Well, I think that your organization has been one of the few that have gone out there and really kind of advocated for more of a dialogue out there among pediatricians and healthcare providers and school educators and things like that to start putting childhood obesity on that radar screen. Am I right about that?
No, we do. And unfortunately, a lot of communities, not a lot of communities, but the focus and the benefit of the physical education in the schools, I don't think is really, at times, isn't valued as much as it should be. Now we are seeing physical education teachers teaching children about health and nutrition and making those right choices because that's what they need. I mean, that is part of physical education. It's not just going in the gym and playing dodgeball for a couple, for that gym class. They're learning how to stay healthy and to make the right choices. And when they go to the grocery store with mom and dad, how to make those right choices for themselves.
If you're just joining us, our topic today is the increasing statistics about childhood obesity. Unfortunately, 16% of children, about 9 million children nationally between the ages of 6 and 19 are considered overweight. It is a chronic disease because it will lead to other illnesses. My guests today are from the Council for Children and Adolescents with Chronic Health Conditions, Executive Director Denise Brewitt, and member of the council, Sue Avard, who is also a registered nurse. We're talking about childhood obesity. Please stay with us.